policies and administrators coming directly from the federal government?
Yes.
The problem in here, they are not doing the studies. People that had it, you know, and the people that have been vaccinated, they're not doing any antibody testing.
Now you got this guy in room 4 who got his second dose of vaccine on Tuesday, has been short of breath. Okay, now his BNP is elevated, D-dimer elevated, ALT, all his liver enzymes are elevated. His PTINR is elevated.
He's got myocarditis.
Yes.
Oh, this is bullshit.
And then let's see.
It's probably myocarditis due to the vaccine.
Right.
But now they're not going to blame the vaccine.
Well, and you know what? But he has an obligation to report that, doesn't he?
Oh,
it happened, right? What is it? 60 days after, if you see anything?
They have got to.
But how many people are reporting?
They are not reporting.
Right.
Because they want to shove it under the mat.
In this instance with Dr. Gonzalez, what patient was she referring to, or without saying
She
the
was
name?
referring to that patient that had congestive heart failure.
Congestive heart failure. And in that particular patient's case, it was not reported.
No.
I'm going to have to transfer you to another hospital. Okay. We don't have cardiologists here. And what you're developing is like a congestive heart failure. Okay? And that's not good. I don't know where this is coming from. On July 29th, you had the first COVID vaccine, and August 19th, you had the second. You know, you don't have COVID, okay, but you have got a lot of symptoms, you know, and you're developing congestive heart failure.
Were there other instances that they didn't report?
Oh, I've seen dozens of people come in with an adverse reaction.
Was one of the ones you saw a 15-year-old with blood clots?
Yeah, so I was just covering a nurse. He's in here with bilateral PEs, but he's fine. And I'm like, okay. So he wasn't on oxygen or anything like that. And I said, was he vaccinated? And then she's like, I don't know. So then I looked in the chart, and he was. He had the Pfizer vaccine at the end of July, and he was due for his second dose. So this is essentially 2 to 3 weeks later. Most likely cause of hypoxia, unusual PE at this age. Unclear etiology. They don't know why he got it.
So how do we know that the blood clots, or how do you know that the blood clots are a result of the COVID vaccine?
Because this is a 15-year-old, normal weight, healthy child. No reason for him to have a blood clot.
It's a shame they're not treating people. I know. Like they're supposed to, like they should. And I think they want people to die.
And how many have you seen that have gotten vaccinated here?
That got sick and side effects? A lot.
A lot?
Have you seen it too? Yeah.
Yes, and I'm like, who's writing the VAERS report?
Nobody, because it takes over a half an hour to write the damn thing.
Right.
The CDC website, it says that you're required to report adverse events following vaccinations. Is there a policy at the hospital for reporting these complications? No.
There's never been any directive sent out on reporting. With this vaccine, we are in stage 3 clinical trials. Normally, stage 3 clinical trials is where you gather your data. What the responsibility on everyone is to gather that data and report it. And if we're not gathering that data and reporting it, then how are we going to say that this is safe and approved for use?
How come after 18 months we haven't had any research? Isn't that fishy to you?
It doesn't.
It does. It is
doesn't.
It's super fishy.
Not that it hasn't been done. It hasn't been published.
It hasn't probably been done because the government doesn't want to show that the darn vaccine is full of shit.
What does she mean by full of shit?
It's not doing what its purpose was.
And what is Dr. McGee saying in that video?
He's trying to defend the vaccine.
Why would he do that?
Because that's his view on it.
Okay.
His view is get the vaccine, it's science, right? If we all just get it, this will all be over with.
Such a bunch of bullshit.
What we're gonna have to do is we're on the inside. I'm thinking about it.
And what do we do?
I don't know, but there's so much I want to blow up.